here. And so I'm going to start recording as well. Okay, so you want to work in healthcare, or you're thinking about healthcare maybe. So careers in healthcare are really in high demand. So that really offers a lot of stability. People are always going to get sick or age, so nursing, those LPN, STNA, phlebotomy, all of those careers in healthcare are all excellent goals and options for you. In this chart that you see below here, this is from Ohio's in-demand jobs, and it shows that there's going to be approximately 4,300 RN jobs opening yearly. So a lot of RNs will be needed. As you can see here, that wage is about a $60,000 a year position. Nursing assistants also in high demand. And then also you can see down here LPNs. So the RN and the LPN as well are both really in high demand. We're going to watch a really quick video here. That's it. Give you a little information on that. Okay, so as you can see there's a lot of different areas that you could go into when you're interested in the healthcare field. And if anyone lives in the Columbus area, you can see that was there from Ohio University. There is actually a program there in Dublin through Ohio University where in the summer where you can test out some of those different healthcare careers. It's a really great program, so you can always reach out to us if you're interested in that. So although becoming a registered nurse is a great goal, there are other occupations in healthcare and then many pathways to getting there. So this is an example of one pathway to becoming an RN. So first you could become an LPN. Where you can see there that median salary is about $40,000 a year, so they do make a pretty good salary. The growth is really good, lots of openings in those fields, and then you can work as an LPN with that certificate and then go to school to become an RN. Then you could even go further, getting your bachelor's, your BSN, and then your master's degree as well. So you can keep going, but there can always work as you're going on that pathway as well. So I want to go ahead and take a look at some other careers in healthcare other than just nursing. So I kind of wanted to make this interactive and throw this out. Does anybody have a career that they're maybe interested in, comparing what type of salary that might be, or any questions about any certain careers in healthcare other than nursing?
I cannot remember mine.
Okay. Now, I've gone into Advanced Path here. This is a platform that we use with Graduation Alliance. Is something made by Graduation Alliance that is available to our students. So if you don't have an account yet, please reach out to us or on our YouTube page. The link will be in this presentation as well. But we can give you the link so that you can fill out and set up an account. It's a great tool to use. But let's explore some careers. So I was going to look at here maybe just medical. I just do a search for medical, any experience level. You can see here some of the different careers that you could do in healthcare: funeral director, medical director, scientist, physicist, writer, physician, medical lab tech. This is a really high in demand career field. I know that a lot of the hospitals are looking for people in these positions, so that's a great option. And as you can see here, if I touch on the name of the position, it's going to give me more information, such as the duties that person would perform. So medical lab tech is a great ultrasound tech, and a lot of positions out there for that. And EMT paramedic as well. All of these would fall under different careers in healthcare. Anybody have any of these that look interesting or want to learn more about them?
The sonogram tag is cute.
Okay. Yeah, so let's go ahead and just compare a couple of those. So here you can see a caregiver. So that would be someone that works in the nursing home, helps with light housekeeping, medication reminders, things like that. So that one, that person's salary is 18 to 23, but you normally do not have to have a degree for that position. Now the ultrasound tech, over here, you would need to have probably an associate's degree. So you can see here that salary is quite a bit different, from 55 to 79, and it's about a medium hiring trend. So we can also go back into the search, and we can do a search for medical careers again. And then we can sort it by hiring trends. So we could see here, how the medical lab tech is a high hiring trend right now. So that's, a lot of people are needing to fill those positions. So that would be a great field to go into. So I wanted to show you here a little bit about Advanced Path, and while we're looking at some healthcare careers. Any others that sounded interesting that you would like to get more about? Or should we move on? So LPN versus RN, what is the difference? So that's a question that I hear a lot. The big difference is really going to be in the training that you receive. So you're a registered nurse, you're going to have a minimum of an associate's degree, so at least 2 years. Usually it's going to be 2+ years. Excuse me. Normally you have to complete your general courses first and then go into your nursing courses, and then it's usually 2 years from there. Registered nurse more often is going to work in a hospital. To become a registered nurse, you have to take what's called the NCLEX RN exam, and they have a median salary of around $60,000 a year. The LPN is a little less in education-wise. So you either do an LPN program, is usually about a year or so, a year of nursing classes. And those LPNs more often work in long-term care or in medical doctor's offices. They could work in hospitals, but it's more often hired in those long-term care facilities. They do take a test as well, but it's the NCLEX PN, so it's just a different assessment, and their salary is a little bit less there. So you can see the more education you have, and then of course the BSN would come after the RN, and that's where you would receive a bachelor's in nursing, and then that salary goes up from there as well. Any questions on that? Okay. Watch a short video here that kind of tells you more about an LPN career. As you can see, the national level, it's growing faster starting in 2022. So they're saying by 2030, there's going to be a shortage of about 151,000 full-time LPNs. So they're really going to be needing people to go into this field. So let's take a quick look at this video.
Equal parts of passion and competence, licensed practical nurses and licensed vocational nurses, or LPNs and LVNs, play a crucial role in providing patient care. LPNs and LVNs help patients in nursing homes and other healthcare facilities, working under the direction of doctors and registered nurses, or RNs. LPNs and LVNs check patients' vital signs, change dressings, and provide other types of basic patient care. They also help patients bathe and rest when needed. Record keeping is an important aspect of the job, as it is communicating patients' concerns and questions to doctors and RNs. The exact duties of LPNs and LVNs vary by state, but their role on the front line of patient care doesn't. Practical nursing takes patience and stamina. Attention to detail is essential in nursing care, as is being observant and communicating clearly. Licensed practical nurses and licensed vocational nurses work in nursing homes, hospitals, doctors' offices, and in home health care. Becoming an LPN or LVN starts with completing a state-approved program, which usually lasts about 1 year. Licensure is required in all states.
So you can see here, this is Career One Stop, which is a great website as well. This is the average pay here across the U.S. So if you're looking in a different state, you could look here and find what they actually make in certain states. The typical training that is required. Lots of great information on all different types of careers on this website. So planning for a career in healthcare. They are in high demand, like we talked about, but there are steps that you need to take in order to get there. So it's really important to start planning ahead. Both of these positions require some training after high school. So they all require you to go to some sort of a college or a training program. These are some of the different ones. I just did, looked at some programs in different states to see, the LPN RN program in Schoolcraft in Michigan. It's an associate's degree, which is a 2-year program. This Wayne County Community College in Michigan, they have both the associates and an LPN program. I'm going to click here just so I can show you basically some of the requirements for this program. If I show you here the median wage again and where they were, but let's look at the courses. So this is kind of what's important here is that you're taking anatomy and physiology, quite a bit of that, and then going into those nursing courses. And it's really the same thing in really any nursing program. That anatomy and physiology is going to be one of the first courses that you take, and medical terminology. So you have the option to take those early and take those in high school. That can really get you ahead. Also, taking those courses like Algebra 2, a lot of biology, those sorts of classes can help you when you are getting ready to take the tests and everything that are required in order to get into these programs. Anybody have any questions about that? Okay. So we can go back into advanced class here for a moment. And I wanted to show you maybe some of the different colleges and those programs, and so you can see kind of the differences. So in advanced class, again, we can do a search, and we can do a search by academics. Or by size, environment, or by major. So a lot of different things that we can search by in here. So if we look at the it's going to show us some of the colleges that offer programs in it. Is anybody on the line shout out their city for me or where they live, and we can look at some programs around you?
Michigan.
Okay, what city in Michigan?
I live in Davidson, but I think they would be like in Flint or Lansing.
Flint. There we go. Okay, so there's three different.
I'd say either Flint or Lansing, Michigan as well.
Okay, let's try Lansing and see if there's
Lansing.
There's a few more. Okay, so those just we've got two listed here. So let's choose those two. Here's how we compare those so that we can kind of see what the difference is. Compare the two. Okay, so Lansing Community College is a two-year program. Michigan State before. So they offer a bachelor's of community college. It's going to be, associate's degrees. You can see the sizes of those colleges here. Tuition, looks like we don't have the data on that one, but you can see over here the tuition for this school. And generally, the community colleges are generally going to be a lot more cost effective. So a lot of people will choose to, go to the community college first, get their beginning courses, and then transfer to a university. And so, yeah, this is kind of. Let's go back into. Do you have anybody in Ohio or in another state? There's one community college, another one in Michigan. So if you click on that, you're going to give you even more details here, such as the programs offered. You can see they offer lots of different programs in healthcare. They do offer nursing. And I have found, with these nursing programs, a lot of them do require you to be an SPNA first. So if you're thinking about going into that career field, it's a good idea to start thinking about that as a stepping stone. Okay. Admissions requirements for nursing programs. So first, if you're interested in going into one of these programs, you need to first be admitted to the college. So some colleges require the SAT or ACT, depends on the college, but normally the community colleges, they do not normally require those tests. They will normally give you what's called the active placement test. And that's just, it's not a pass-fail test. It just sees, it's testing you to see where you are so they can place you in courses. But you can see as an example down here, this is the requirement for one of the schools. So once you're admitted into the college, then you would need to take what's called the TEAS test. So the TEAS test is the test that is what would get you into the nursing program. So for Schoolcraft, you can see down here, these are the minimum scores. So you have to have a composite of 60%, 68% in reading, 60% in English, 60 in math, and 50 in science. So those are the scores that you would need to achieve on the TEAS to get into that program. And it's different just based on which school you're looking at. Any questions there? We're going to go a little bit more into detail about that test here. This test stands for the Test of Essential Academic Skills. And it's going to test on reading, math, science, and usage of English. Okay, so many of the nursing programs I know in my area, they accept people based on those scores. So the better you do on that test, the better chance you've got of getting into that program. And I thought this video gives you some good information.
I just wanted to stop in and do a quick video on information on one of my nursing school websites about the team. This is just a quick update. I am currently in level 3. I will take my final. We'll start with after New Year, January, and if all goes well, which I am planning, I will be graduating next May 9th. So I'm excited. But it's the time went by really fast. It has been scary times. It's been some exciting times. It's been an experience. That all the guys get a chance to, get into the school of their choice and pursue every dream. But anyway, I did that. Our school actually gave us an open website on which honestly I don't understand why, because we have to pass people in order to get into the program. But they're really good resources for those who are still out there struggling with things or looking to do some additional practice on things. I wish I had this information prior to me taking my test, but unfortunately all I have is the textbook and just studying on my own. But it's a few websites that I'm going to list in the description of this video that you guys can easily take advantage of. Hopefully it helps you guys. So just wanted to stop in and let you know that I have resources.
Okay, so she's doing great. She's almost done with her nursing program, and you can see down here, these are some really great resources. I checked these out, and gives you a lot of great materials to help study for the TEAS test. If you're thinking about going into nursing, it's never too early to start getting ready for those tests, both the AccuPlacer and the TEAS test. It's helpful to start doing some practice tests and getting some information about what's involved in taking that so that you're prepared. Some of the other assessments, I mentioned the AccuPlacer. This is the test that most students are going to take to get into school. So Cincinnati State, Stark State, Wayne County Community College in Michigan, all of them require the AccuPlacer test. And there's a link right here. If you click on the link, it takes you to that website. There are practice tests. They even have some apps and things available to help you get prepared for those tests. ALEX is another assessment that a lot of schools are giving. That's a math skills assessment. And then the ACT and SAT, which are the 2 college readiness assessments. So taking those 2 courses of the SAT and ACT are definitely a great way to see how you are with college readiness and if you're ready to apply to a university or community college. Some partnerships that we have in healthcare, I just wanted to mention, we have secured a partnership with CVS Health. They offer a pathway into nursing and a lot of other healthcare careers. The clerk RX position they have, you work as a clerk in the CVS store, and then they offer some paid training and assistance with certifications to become a pharmacy tech. So that's something that's a great opportunity. They do have careers in many different areas, nursing as well, and they advance from within, so, and have locations all over the world. I also have some links down here to some of the caregiver partnerships that we have. If you're looking for a position, like I mentioned in the beginning, those caregiver positions don't require the certification. Many of those you can actually work and do, while you're finishing up your diploma. Gives you a great step into the healthcare field, and especially if you're interested in nursing, that would be a great first step. So what questions do you have? Any questions? Okay, doesn't look like you have any questions. So I really appreciate your time tonight. I'm going to post this onto our YouTube page. So in the next few days, if you want to review it again or check out those websites, you can do that on there. And please feel free to reach out to us if you have any questions or if we can help you with your college or career search.
Can you email me that slideshow?
I sure can.
It's just AnnHackett86@gmail.com.
Okay, email.
Yeah, 86.
Okay.
Thank you.
Of course. All right. Thanks for joining tonight, everybody. Have a nice evening and happy holidays.
You too.